Hi, good afternoon, everybody. My name is Nastri. Okay, today we are going to talk about commuter force prevention, community safety, use of walking aid, and exercise. So we will keep to a question and answer at the end of this session. Five tips to prevent fall. So firstly, keep your home safe and neat. Keep your keep your bones strong. So we encourage to drink high calcium milk or food. Exercise regularly. Go for regular eyes checkup and wear well-fitted and non-slip shoe. So Singapore context, age 65 years and above, 1 of 3 people fall each year. For age 72 and above, falls every 2 years. For 80 and above, fall every year. So it's important to keep yourself healthy and your bones strong. So what is the consequences of a fall? It can lead to firstly head injury, loss of independence, bruise and cuts, fractures, bone, fear of falling again, decreased quality of life, loss of self-esteem, and some fall will lead to death. Oh, not in. Okay, regular exercise, at least 150 minutes of physical activities a week. Exercise will strengthen your muscles, help to increase flexibility and endurance. Perform strength and balance exercise at least twice a week. For example, Tai Chi or Qigong. 7, easy exercise to an active lifestyle. So I would like to ask you, if you want to take photo, you can take photo all the different type of exercise that I'm going to share. And also this session also be recorded at Radiman's Facebook. So first, what you can do a simple exercise at home, stationary march with arm swing and seated march. Sit to stand, standing hip extension, slight leg raise.
Sorry, the screen is not changed.
Oh, the screen. Can see? Oh, okay. Hold on.
Same screen, consequences of fall. No exercise screen, please.
Today one, what?
Today one.
Today one,
I'll take picture later. Okay. Correct.
Okay,
correct.
can see. Okay, so sorry because of the hang. Okay, hold on. I
Thank
go. Thank you. Okay. So first, okay, you can take photo if you want, because I'm so sorry that I cannot show you all the exercise physically, because my community in the sport is not big enough. So I will go through the hands with you together. So first, what you can do is at home, stationary march with arm swing, or if you sit down, you can do a seated march. So firstly, warm up. Prepare your body for exercise by gradually increase body temperature, gradually increase your heart rate and blood circulation throughout muscle, tendons, and ligament. So please remember, when you do exercise, must remember to breathe in, breathe out, okay? So number 2 and number 3, strength exercise. Sit to stand, reduce bone and muscle mass loss, reduce back pain, and improve strength to perform these activities with ease. You can also do like climb stairs or carry your grandchildren. It's also using your strength and exercise also. Balance exercise. Improve coordination and balance. Perform this everyday activity with ease.
Sorry, can you show 2 and 3?
Okay, sure. Hold on.
Sorry, I missed 2 and 3.
Okay, number 2 and the 3. So sit to stand. And you see number 3 is the standing hip extension. So you extend your hip. Can? Okay, I proceed.
Thank you. Yeah, thank you.
So number 4 and 5 is the balance exercise. So number 4, side leg raise. So you can do hold the chair and move your side leg at the side. Number 5, single leg stand. So you lift up your leg. Do at your own pace and at your own comfort position. Okay, this one is you sit down. It's called flexibility exercise, tricep stretch. The purpose is to increase range of motion and freedom of movement. Perform this activity daily with ease. Yeah, you can watch TV also. You can do. Yeah, it's the same as you make bed. You stretch also, right? Or you bend down. Also another thing is when you tie your shoelace. So cool down. Cool down is gradually decrease heart rate to normal, reduce muscle aches after exercise. So it's called stretching lah. Another word. So standing quads tricep stretch. You stretch your leg. So before we begin the exercise, do not perform this exercise if you feel unwell. For example, you feel giddy or if you're having cold sweat, cough, fever, or running nose. Use a sturdy chair with a back seat to support. If you're performing this exercise seated, stop exercise if you're having pain or pressure in your chest, neck, shoulder, or arm. So step 1, we can do stand tall. March slowly on the spot at your own pace. Step 3, leave your knee slightly higher. Step 4, swing your arm as you march. Continue this for at least 1 minute. Then you can feel the difference. For real senior, what you can do, sit straight and tall, stand on your lap, lift up. Step 2, feet firmly on the ground, shoulder apart. So when you're sitting down, you can march and focus on lifting your thigh off the seat. You can continue this for 1 minute. Strength exercise. Step 1, sit tall with your feet shoulder width apart and arm extend forward. Put your hand in front, you look in front, look forward, and maintain a straight back. So your body is straight. So what you can do, you can lean forward slightly and breathe in. Then you can stand up slowly and breathe out. You can repeat 10 times. You sit and you stand up, you sit down and you stand up again. So this is standing hip extension. Step 1, you stand tall with your feet shoulder wide apart. Hold on to the chair. Keep an upright posture. Step 3, lift your leg off the ground and towards the back. Keep your feet straight and repeat 10 times. Slowly return to a standing position. You can repeat this step 1 to 4 for your right leg and also your left leg 10 times. The balance exercise. Slight leg raise. Step 1. Stand tall beside a chair. Feet shoulder apart. Hold on a chair. Keep left leg straight and raise it laterally towards the left side of your body. So slowly return to standing position. You can repeat this 10 times. You can do for your right leg and your left leg. Flexibility exercise. Step 1, so you sit tall with your feet shoulder wide apart. Place firmly on the ground. You can lift your left arm over your head. You can place your left hand over the back of your neck. Place right hand on the elbow and pull it gently towards the right. You can feel the stretch in your back arm. You hold for 20 seconds. Okay, then you can feel, you can change. You can repeat on the other hand. Can you feel the stretch? Oh, it's very good. Okay, next. Cool down. So you stand tall. Place your right hand on the chair to support. You grab your left leg. Be careful if you not steady, if you cannot hold on to your one leg, then don't do it, okay? Okay, then you lift up your leg above the ankle and lift towards your buttock. Then you can feel the stretch. Hold for 30 seconds. You can repeat again. You can do it for your right leg. Hold on for 30 seconds. Okay, do you feel good? Okay, now next topic, I would like to talk about walking aids. Walking aid is a device designed to assist walking and improve the mobility of people who have difficulty in walking or people who cannot walk independently. What is the purpose of walking aid? Is to increase area of support or base of support, to maintain center of gravity over supported area, compensate for weak muscles, decrease pain, and improve your balance. So there are many types of walking aid. So example, single point walking stick, quad stick, walking frame, and rollator. Single point walking stick is a lightweight, small and simple, meant for patients who needs minimal support, improve safety and balance compared to non-walking aid. So if you see the walking aid, if you see the below, there's a base support. Compared to your umbrella, some umbrella is just the umbrella, but the support, the base there, there's no rubber band. Quad stick. Quad stick is the larger base support than single point walking stick. Broader base quad stick are more stable in safety and balance. Usually prescribed to patients who can use only on their one hand, for example, stroke. Walking frame. Walking frame is more stable among all walking aids. It prescribed to patients who need support on both sides of the body with limited standing balance and weaker lower limb strength. They have a slower walking speed. If you see, there are four legs. It's like walking frame 1, 2, 3, 4 to support firmly on the ground. Rollator. Rollator is easier to move but do not require to lift up the walking aid. It's like a wheel. You see all the four wheels, so it's more stable for you to push. Prescribed to those who want to practice normal walking pattern. patient who have cardiovascular endurance. This one you, because you very fast. This one you move very fast with the wheel. Like you are normal walking, but you just holding like a push, the rollator. So this one, if you feel those who easily feel tired or breathless, we are not encouraged to use this rollator. Choosing the right walking stick. The tip of walking stick maintains balance and elevate pressure. The height of the walking stick. If the walking stick is too short, you feel unstable because you have to bend down because the walking stick is too short. If too long, your limb might be sore because too long. The handle, if too small, insufficient grip, you cannot hold, it's not steady, you have no support. Tips in the community. Remember to use your walking aid. Walking stick should be held on the opposite side of the affected limb. So, to ensure proper assessment before getting a walking aid. Avoid going out on the bad weather, rain, then better don't go out because the floor is slippery, the road. Run errands during the day where there's a proper lighting. Wear a proper footwear and sit down when wearing your footwear. Avoid rushing when preparing to go out. Covered initiative in Singapore. Feature grab bars in the bathroom and non-slip floor tiles. Lift upgrading in the HDB. Lift serving every floor. Slower escalator in the MRT station. Extended green man timing for seniors. Increase ramps facilities in the neighborhood. Healthcare easily accessible in the senior activity center. Or there's also community nurse posts within the neighborhood to cater for aging population. So community nursing have 32 community nurse posts. So we are divided into 5 zones. So there are Teluk Blangah area, Chinatown, Katong, Bukit Merah, and Tiong Bahru. And this is our hotline. So we have come to the question and answer. Which one of the following is not the tips to prevent fall? Anyone wants to share? A, keep your bones strong. It's not, which one is not? Regular exercise, go for regular foot check, or wear well-fitted and non-slip shoes will not prevent fall.
C.
C. Oh, okay, thank you. You are?
My name
Yeah.
Christina.
Thank you, Christina.
Why should you thank me?
Yeah, correct. Okay, so go for a regular foot check will not help to prevent fall. So keep your bones strong is important. So by eating the correct food and drink calcium food, vegetable, and exercise regularly to keep your bone strength and muscle strength also. So wear the well-fitted shoe and non-slip shoe so that you have enough support and grip. Question 2. Umbrella is a type of walking aid. Is it true or false?
False.
False, yes, correct. Umbrella is not a type of walking aid, okay? Question 3. The recommended duration for exercise per week is 150 minutes. True or
True.
false?
True.
True. True.
Yes. Yes, okay. So 150 minutes, so if you divide it by 7, 7 days, so at least one day, around 21 minutes lah. So at least every day we should exercise, at least walking, exercise or go for a brief walk in the morning is good, or afternoon. So about 30 minutes every day, then you can achieve 150 minutes a week. Exercise is recommended for everyone. True or false?
True. True.
True. Okay. Yes, true. So everybody is encouraged to exercise. If you cannot stand, you can sit down. Do the simple hand exercise, leg exercise, marching, as recommended just now.
Yes.
Question 5. Walking stick should be used at the same side of your affected limb. True or false?
False.
False. Opposite.
Opposite side. Hey. Hey.
Yes, correct. So remember, your walking stick you must use on the opposite side of your affected limb to get you have so that more support.
Reference.
Okay, so I have to come to end of my session. You, you get any question?
Yes. May
Okay.
I ask? May I ask you? Hello.
Hello, hi.
May I ask you? Osteoporosis patient. Do you recommend the person to exercise or any precaution? Thank you.
So for osteoporosis, right? So we encourage everyone to exercise. So for osteoporosis is the bone problem. So it's best to check with the doctor or the physiotherapist on the level of exercise that you can do. Because you also cannot do aggressive exercise because see some people they on osteoporosis they on this calcium medication, or some people severe one they have to be on painkiller. Some people they take painkiller on a regular basis, but they don't feel the pain. So if you don't feel the pain, they can exercise regularly. So we encourage for all of you to take high calcium food or drink or milk. So if you go to the shop, so you must every time look for milk is a high calcium, so that you have a lot of calcium in your diet every day.
How about slow jogging? Is it still good for elderly?
Yeah, it's good. So it depends on your body and depends on yourself whether you okay to go for a slow jog, but see whether if your body can take it, you don't feel the pain, don't feel the muscle ache or cramp, you can go for a slow jog. Yeah, as long as the good thing, as long as you walk or do exercise for at least 150 minutes per week or at least 30 minutes per day.
If more than that, more like 1 hour a day, is it okay? Is it too much?
Okay,
for
depends whether if your body can take it. If for some people they have been exercising for example they every day from I got resident they every day at 7 o'clock they go down, they walk for 1 hour, 1 hour walk, they do a walk or slow jog, slow breeze, and they feel good, they feel no, they got no problem, no leg cramp or leg pain. So if you are doing this every day and your routine is okay. So for example, but if you want to start on a beginning, so you do on a slow pace. For example, today I do for 20 minutes. Then after that, tomorrow I increase a bit, 30 minutes. So if you think your body can take it, then you can do a bit more. But the average recommendation is at least 450 minutes per week. That means around 21 minutes per day lah.
Oh,
Yes.
thank you.
Excuse me, may I
like
ask?
it.
Sorry. If we rely too much on the walking aid so the patient will keep relying on, then cannot see the improvement or not. Let's say
Okay.
without the walking stick, you cannot walk properly, then how?
So is all this working is through recommendation. For example, if you don't want to depend on walking aid, but it will lead you to more serious problem. For example, if I don't want to rely on walking aid, but if I go out, I want to force myself. If I don't use walking aid, but I know I'm not steady outside, I walk. If I don't want to use the walking aid, if I lead to fall, it will have a more serious consequences. So I would rather use a walking aid that I prevent myself from a further serious problem than I don't use a walking aid at all. So you have to see whether, okay, if I don't want to use a walking aid, for example, try at home. Whether you okay, you steady. Yes, if you okay, then you can try at least at home. If you want to try yourself, at least if you don't have a walking at home, you have something to grab at the side. But if you think I cannot without use a walking aid, I need to hold on to something to support myself. Yes. So that is the recommendation. If you need to use, please use it. Rather than you don't use at all, then it will lead to a serious problem and complication.
Thank you. What about physio? If you go regular physiotherapy, can help or not?
Yes, definitely. So, what we recommend, so usually for them, depends on the needs that you need to go for physiotherapists. So usually on your first session, they will do an assessment first. Said how long or frequency that you need a physiotherapist. So for a normal regular one, for example, they just need once a week or twice a week. So the physio will teach you at the center, you can do this. Then after that, usually physiotherapy, they will give you a chart or a paper, a picture, how you can do at home. So don't just depends on the physiotherapist during the session only. You also have to go back and practice more. Yes, because but also financial also have to depend, because every physiotherapist is a cost. So if you need to see the physio, then after that you can do it at home. That will be a better recommendation. So when you see the next session, then you can tell the physio, I have been doing this every day, and the physio can see that there's improvement in your strength on your limb, so that you will get better.
Okay, thank you.
Zoom, pastor. I have a question to ask.
Hi.
This one is pertaining me. The other time I feel my legs was a bit wobbly. Then I had a fall twice. Then after that, I doing a lot of exercise, and I using this a roller pen which my friend recommend from the company. I'm using it. It's very effective, and since then I never had a fall. But
That's
the
good.
thing is that I worried that Singapore got a lot of steps. You can miss the step and you can lose your balance. So I always use an umbrella for precaution. Is that okay instead of using walking stick? So it's also in a way that I don't use it at home. A short distance. If I walk long distance, I'm very worried about the pavement. In case I miss the step, I lost my balance. So I use the umbrella. But this umbrella also, in the other hand, also helpful. In case raining, I can use it. Instead of walking stick, I'm so helpless.
Okay. So so good. Sarah, you mentioned what did you use? What is it called?
It's a
Roller,
roller pen. A roller
roller.
pen.
What?
A roller pen is made from Japan.
I see. What is that for? Exercise?
No, it's a pen that is can do compression on your legs, and it's
Oh,
when you walk, you haven't got any more pain anymore. A lot of friends
the.
I recommended. When I use, I talk to them. They
Mm-mm.
all bought and they use it very good. I should
I
think you all,
see.
the community should provide. It's a bit expensive, but
I
you
see.
can use it very comfortable with the leg.
Oh, okay. That's good that you is effective on you, and it's good. So for example, if you use umbrella but you don't in the community, you don't require a walking stick. So if you don't require a walking stick, if you want as a support, umbrella can. But if the doctor or the physiotherapist say you need a walking aid, at least a walking stick, then you use an umbrella, then it's wrong. So if you don't need, then as a prevention only, then it's okay. For example, you can use as a support. So for example, now rainy days, right, you also want to use as a umbrella, then okay. Then because if you use umbrella, then you don't have a support already. Then that is dangerous. If you need a walking aid but you do not use a walking aid, you use an umbrella. But if you raining, then use umbrella, then you don't have a support. Then it's very dangerous.
So someone mentioned about the roller. Do you have sample? Can show the sample?
A roller pen.
Ah,
You want to see? It's okay. I can show it on the screen.
if you don't mind. Is it? I don't see. What's your name?
Get you lah.
Okay, I have to forward to your Gechu.
Hi, how about show it in the chat?
I don't know where I put my thing now. I'm looking for it. Are there? This one. Yeah. There.
Can show on screen? Cannot
Yeah,
see.
here. Can see or not? Wait, I show
Cannot
you.
see.
Wait, let's see.
Can't see your face.
There, wait. This one, the picture is on the screen. You see, I cannot see.
No, I don't see on the screen. How do I see?
There, this one. It's a pantyhose like that. See? It's a pantyhose like that. But the legs is opening one. And so far, all the friends use it very good. I can WhatsApp you all about the testimonial. They use it.
Oh.
Is that okay?
No, can you please put down the name in the chat so that we can see what's the brand name?
Chat
In the chat, you type down what's the brand name?
Okay. AUROLA. Alora. AULORA. Hello, you got it?
AULORA.
Arola pen is you can zoom it at Facebook. And I have a friend who I was using this when I went for my physio and my leg was still very painful. So happened that this lady talked to me. Then she came to my house and measured it. So I'm using it for almost 1 year already. Before I cannot walk a lot, no. Then after I wear this one, it will help. I asked other friends who are working like nursing or what, they have a long walking, so they buy this. Is very good.
Okay, thank you. Because depends on individual lah. So whether you can.
It's not individual. It's 2-1. This is really a 2-pack.
Okay, can. So any other question?
Yeah, hi. It's not my computer hang, so I have to switch on and off. I missed all the slide after your last slide on the community nurse post.
Oh, okay.
Subsequent slide, can you show again so that I can take a picture if it's useful? Thank you.
Hold on.
Actually, I did ask Jared to impart the knowledge, but Jared said it's not very keen, so I never give them the info.
After the community members post, it's just a question. It's a more on a question and answer. Yes. Any more question that anyone to ask? So can I ask whether do you do all of you do on a exercise? Do you exercise regularly?
Yes.
That's good. Okay. If no more session, no more question. So next week is in Mandarin. So my colleague will deliver it in Mandarin, and you can go through the slides again lah.
Thank you.
Thank you very much.
Thank you, everybody. Hope you benefit and do remember to exercise.
Yes.
Walk a lot. Walk a lot can I walk a lot.
Yeah, walk. Yeah, just walk is good. Yeah. To achieve your strength and balance of your leg lah.
Thank you.
Okay.
Actually, always feel happy when we exercise.
Yes, because when you exercise, you feel good. You perspire and so that and also drink a lot of water after that. Okay.
Yes. Yeah.
Yes.
May I know after you fall down, can you exercise immediately?
No. So after you fall down, it all depends how serious or severe is the injury of your fall. So it's recommended to see a doctor to check whether is there any fractures, limb, or is there any bruise or cuts. So it will lead to fall. So it's best that you see whether is there any pain. That is the most important. Whether you can exercise or not. So depends on individual. So better to see a doctor after a fall to check whether some people can lead to a serious problem, fracture, and some people will need a X-ray to see if he's still in pain. So no more question. So I will see you next week in Mandarin session. My colleague will be giving in Mandarin.
Hey, thank you.
Thank you, everybody. Okay, bye bye.
Yeah, thank you. Okay, bye bye. Thank
Have a
you
nice
very
day,
much. Thank you.
everybody.
Yeah.
You too. Take
Yeah.
care.
Mhm.
Yes.
Bye.
Thank you.
Bye bye.